Are you having pain or soreness in your calf? Yes, I'm asking you. Are you having pain or soreness in your calf? You may be experiencing signs and symptoms of a certain disease or a condition that you know nothing about it. So sit with me, don't go anywhere. Let's talk about it. By the way, my name is Abena. Here is Pomar Health TV on YouTube. On TikTok, Abnanes387. Information on your health education, tune in to Pomar Health TV. If you are out there and your doctor has diagnosed you of a certain condition or disease and you need more knowledge about it, send me a comment and I will give you more information about it. Today, we are talking about DVT. I know it's medical terms, big words, but I'm going to break it down for you. DVT is deep vein thrombosis. Let me come back to a layman terms. DVT is a blood clot in your deep vein. Blood clot in your deep vein. Normally in your legs, or it can also happen in your arms. But most of the times it happens in your leg, but it can happen in your arms. This condition is serious. Yes, DVT is serious. It's serious because blood can loosen and lodge into your lungs. Yes, and I'm going to walk you through the process. When blood starts to clot in your leg, it's going to travel from your leg all the way to the right side of your heart. From the right side of your heart into your lungs. Yes, that's how the process starts. And this is serious because you can develop a condition called pulmonary embolism or a disease called a pulmonary embolism. Since we want to focus on DVT today, next time we'll talk about pulmonary embolism. It's serious. This is serious. Now let's talk about signs or symptoms of DVT. If you are home and you are experiencing what I just talked about, and you are like, how will I know I have DVT? This is the signs and symptoms that you will notice. You are going to experience pain or soreness in your calf. That was why I asked you in the beginning, are you experiencing pain or soreness in your calf? Yes, this is one of the symptoms of DVT. Swelling on the affected area. Do you see there's a swelling on your leg, or in your leg you feel it swelled over there? Yes, swelling is one of the symptoms. Warmness. When you touch it, do you feel warmness over there? Yes, warm or warmness is a signs and symptoms of DVT. Discoloration on the skin or discoloration of the skin. Yes. Do you see that your skin, the affected area, is turning red or purple? Red or purple, depending of your skin color. So if you are white or black, then you will see the kind of skin color it will show on the affected area. Yes, these are signs and symptoms of DVT. So if you are home, all of a sudden you are experiencing warmness in your leg, swelling or soreness on your calf, redness, purple color, warmness, these are signs and symptoms of DVT. Don't sit at home and get a cream somewhere and think you are going to rub it on it and it's going to go away. The first thing you should do, if you are in US, I would say call 911 and go to hospital. Or if there's somebody at home that can drive you to hospital immediately, do that. If you are in Ghana or wherever you are watching me from, I will tell you, rush to the hospital, don't sit at home. Like I said earlier on, the blood can loosen and travel or lodge into your lungs. You don't want that to happen. This is a serious condition. I don't want anybody out there to go through. I know sometimes when you don't have knowledge on certain things, you may end up developing big or complicated diseases. So if there's a way for us to avoid all these things, let's continue to watch Poma Health TV, get more knowledge on your health so that you know what to do immediately it happens. So the next thing is we are going to talk about causes of DVT. Yes, we know blood cannot just clot in your leg. There should be a reason, or you have to do something to cause that to happen. So let's talk about causes of DVT. The first thing we'll talk about it is lack of movement. Lack of movement. And the examples I will give when it comes to lack of movement is going to be someone who drive for long distance. The next one will be someone who travel through airline, or someone who is in bed rest as a result of paralysis. These three things can make someone develop DVT. The reason being is that when you drive for so many hours without taking time to exercise, without taking time to stretch your legs and arms, yes, blood is going to clot. When you travel by airline, anytime is safe and you don't get up, you sit for 9 hours, 10 hours, 6 hours without making any movement, there's a likelihood of blood clotting in your leg or in your arms. The next thing is someone who is paralyzed. When you are paralyzed and you are always in bed, you are lacking movement. You are not doing anything. That's why as nurses, we have to make sure we are turning them every 2 hours. And the therapists out there, we have to make sure we are giving them the exercises they need so that we can prevent DVT. The next thing I'm going to talk about it is age. Research shows that when you are older than 60 years, it puts you at risk of developing DVT. But bear it in mind, DVT can happen at any age. It can happen at any age. But when you are 65, it puts you in a risk position. The next one we'll talk about it is birth control pills and hormonal therapy. If you are out there and you are taking birth control pills, you are taking hormonal therapies, it increases blood clot. So there is a likelihood of you developing blood clot. Yes, you can develop DVT as a result of you taking birth control pills or hormonal therapy. The next one we are going to talk about it is weight. When you are weight or when you are too heavy, it puts pressure in your veins, in your pelvic, in your legs. The pressure that your veins, your pelvic, and your legs are receiving can make blood clot. So being overweight can make you develop DVT. Being pregnant, yes. Pregnant women go through a lot. DVT can happen to someone who is pregnant. The reason is you are carrying another human being inside you. It puts pressure on your veins, your pelvic, and your legs. It's the same thing like someone who is overweight. So the men out there, please treat your wives good. They go through a lot. The next thing I'm going to talk about it is personal or family history. Maybe you or someone in your family has developed DVT before. There's a likelihood of you also developing it if you are in the same family with them. So personal or family history, yes, you can develop DVT on that. What can we do to prevent DVT? before we talk about preventing DVT, let me bring this one in. If you have had injury or surgery in your veins, yes, you can also develop DVT because that will interfere with blood. Yes, blood clot. So there's a likelihood of you developing DVT. And smoking, I don't want to forget that. If you are someone who smoke a lot, please, smoking interferes with blood flow and clot. How blood flow in our body and how it clots. Smoking interferes with it, and you can develop DVT as a result of that. What can we do to prevent all this? Please, if you are someone who drives for long hours, make sure you take time, park the car somewhere, walk around, stretch your legs, do a little bit of exercise before you continue your journey. And if you are there taking birth control pills, hormonal therapies, talk to your doctor. Do it in a safe way to prevent DVT. Let's stop smoking. If you are out there and every day you are smoking, some people can smoke 2 packs, 3 packs, and still be looking for more. Please find a way to reduce how you smoke, and if possible, quit smoking. If you can, quit smoking. It's going to be good for you. Thank you, lovely viewers. This program is sponsored by A Poma Essential Rentals. If you are having a wedding, engagement, naming ceremony, funeral, anything you need for your program, reach out to A Poma Essential Rentals. They have good chairs, machine, generators, mattress, money box, tent, anything. They have everything. That's why they call them A Poma Essential Rentals. Essential means you are number one stop. Everything you need, you go there and you get everything you need once. You don't want to make different trips for the things you need for your program. Just go there once at a time. You get everything you need. A Poma Essential Rentals. Bye-bye.